Beyond the reach of vaccine. That's how one health official describes what's going on in Marfa, Texas. That small West Texas town is a well-known getaway. Artists go there. It's an increasingly popular tourist destination. But right now, they're facing an outbreak so bad that the county judge says 1 in every 13 people has tested positive. And with all those cases, there's just a single hospital for 12,000 square miles. I want to bring in that official sounding the alarm, Dr. J.P. Schwartz, an osteopathic family physician there in Marfa and the health authority for Presidio County. Thanks so much for being with us. And the numbers where you are just breathtaking. The cases have more than quadrupled in the last 2 months. No county health department to conduct daily testing. Just that one hospital. No heart or lung specialist to treat serious cases. How worried are you, doctor, that your neighbors will get sick and not get the help they need?
The ones that are able to take precautions are going to be fine. The ones who don't, which includes a large segment of the population, is under extreme risk right now. Many deny the existence of the virus. They say it's a hoax. We have other people on the border that have a culture that has been untouched for hundreds and hundreds of years. It includes large family gatherings, hugging your children, all the normal interactions. They simply cannot develop a concept of what's going on. And so the virus levels continue to climb. My biggest problem right now is I have no figures. The figures have stopped. We're not getting new data from the state through the health department. It is not being reported. It's very strange. That data pipeline seemed to have dried up right as this story broke in the Times. So I can't say why, but it's happening, and it's making it pretty much impossible to track and trace. We have our own little track and trace unit in Marfa, and they can't do anything right now.
Is there another net effect? Because at least you would like to think that some, if obviously not all of the people who are doubters about the impact of this pandemic would see that their friends and neighbors are getting sick, would see that their friends and neighbors are testing positive and maybe be more careful. What's the net effect of what you're seeing right now, even if you don't know why it's happening?
They go to the state website, they see the numbers going down. Then they go to Facebook and they say, see, the virus is getting better. We're not having as big numbers as we did before. We don't have big numbers because we don't have numbers. So It's pure and simple.
They can't be big if they don't exist. So I know officials there have been asking residents, you're one of them, asking folks to shelter in place, avoid non-essential travel. But I've been to your town. It's beautiful. It's a popular artist and tourist destination. So are people still flocking to Marfa? Is tourism part of what's contributing to the spread?
I really do not think tourism is contributing in a significant manner. Most of the tourists that come here are well educated. I see them walking around town wearing their mask. The difficulty we have is down 60 miles to the south in Presidio. The people regularly cross the border. Many families live on both sides, and they don't seem to be able to contain the spread as it comes back across. We tried a long time ago to block the border, but it's not happening. It won't happen. That's federal laws. They won't allow that to occur. I'm not saying it's all coming in from Mexico, but simply the population there seems to be spreading it faster than other places.
We only have 30 seconds left, but we have the Pfizer COVID vaccine, but it does require that ultra cold storage in those specially equipped fridges. How concerned are you about being even able to get the vaccine given your location? And could the Moderna vaccine be a game changer?
Moderna vaccine would be better. We can't even get dry ice for a birthday party, much less to store vaccines. That's pretty much out of the question. My office is signed up as a vaccine provider, but we don't have any word as to when or where. My guess, it's going to be in the spring before we see any significant vaccines. I hope I'm wrong.
Wow. Dr. J.P. Schwartz, you've got a lot on your plate. We thank you for taking the time to talk to us today, and good luck to you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.